Hello and welcome to another SIU Medicine Minute. We're here today with Dr. Wasey. How are you doing?
I'm good. How are you?
Doing well, and thank you so much for joining us. And can you tell us more about the sleep medicine clinic here at SIU?
So the sleep medicine clinic here at Family Medicine Center was introduced about a year ago with an aim to diagnose people with sleep disorders early on. Now, as statistics say, about 80 to 90% people with sleep apnea, 50% with insomnia fall through the cracks. So the purpose of this clinic is to diagnose these people early on, also to train the primary care physicians that are working there to ask the right questions, use the right tools, and diagnose these people with sleep disorders and refer them to the specialist on a timely manner.
Can you tell us more about the different sleep disorders people may be suffering from?
So the main one that people think about when you talk about sleep medicine is the sleep apnea, and that is the most common one. But apart from that, there are also different kinds of sleep apneas, like central sleep apnea and obstructive sleep apnea. There's obesity, hypoventilation syndrome. These are breathing disorders of sleep. So when people are sleeping, they're not breathing properly. But apart from that, there are sleep disorders like people are unable to fall asleep or stay asleep, which we call insomnias. There are nightmare disorders. There's REM behavior disorders where people act strange in their dreams. Then there's sleep talking, sleepwalking, and then there are disorders of hypersomnia where people sleep more than usual, such as narcolepsy and idiopathic hypersomnia.
And so if someone's coming into the clinic, what is their experience going to be?
So if the physicians that work there, the primary care physicians, feel like they have a sleep disorder, they'll refer them to me. But also we initiated a protocol where everyone that steps into the clinic gets screened with the standardized tools that we use for sleep disorders. So if they score high on those questionnaires, then they automatically get referred to me as well. And then we have a consult and try to figure out what's going on with their sleep.
Okay. And then what about the diagnostic testing after that step?
So when people think about sleep, obviously we have to do the sleep studies. Now here at the Family Center, we do have this very convenient device called a watch pad. Now when people think of sleep disorders, they think about all these wires and hookups on them, and then they get anxious because they're not able to sleep properly with all this on them. But this watch pad device you can see is like a watch. It just slips on the wrist, and then there's a probe that fits on the finger, and it records your sleep overnight. And then the patients bring this back the next day, and we record the data, download the data, and then I interpret the results for them, and we talk to them about it.
It's amazing, super simple and easy. And thank you so much, Dr. Wasey, for talking to us today.
Thank you for having me.
No, of course. And this was another SIU Medicine Minute.